Vitamin B12 is necessary for the formation of blood cells, nerve sheaths, and various proteins. It is essential for the prevention of megaloblastic anemia and neurological disturbances. Megaloblastic anemia is a condition characterized by the release into the blood of immature red blood cells. This is because of failure of the normal process of maturation in the bone marrow. The combination of anemia with neurological problems is typical for a vitamin B12 deficiency and is known as pernicious anemia. Vitamin B12 is also involved in fat and carbohydrate metabolism and is essential for growth. Vitamin B12 functions mainly as cofactor in intermediary metabolism, the process in which nutrients are converted into cellular components. 3 enzymes are dependent on vitamin B12. B12 is the cofactor for methionine synthase, the enzyme that recycles homocysteine back to methionine. Methionine synthase and vitamin B12 are involved in the production of the active forms of folate. Low B12 may disrupt folate metabolism. This is how B12 metabolism is related to folate metabolism. Another enzyme, methylmalonyl-CoA mutase, converts methylmalonyl-CoA into succinyl-CoA. This is an important reaction needed to produce energy from proteins and fats. Succinyl-CoA is also required for the production of hemoglobin, the protein responsible for transporting oxygen in the blood. The third enzyme that needs B12 changes the 3D structure of the amino acid leucine, but not much is known why this occurs. The exact reason why vitamin B12 is needed to maintain the myelin sheath that surrounds the nerve cells is not clear yet. A lack of B12 affects up to 50% of people over the age of 60. Lack of B12 leads to defective DNA synthesis in cells, which influences the growth and repair of all cells. Tissues most affected are those with the greatest rate of cell turnover, for example the bone marrow that is involved in the production of blood. Vitamin B12 deficiency can also lead to increased levels of homocysteine, which is a possible risk factor for vascular disease. Low vitamin B12 has been associated with a variety of chronic diseases of aging, such as dementia and cognitive impairment, heart disease, and osteoporosis, the disease in which bones become fragile. The symptoms of B12 deficiency are similar to those of folate deficiency, but the major difference is that only a lack of B12 is associated with neurological disturbances. If folic acid is used to treat a B12 deficiency, the anemia may be cured, but the risk of damage to the nervous system remains. If left untreated, nerve problems associated with a lack of B12 can be irreversible and potentially life-threatening. It is essential to diagnose the deficiency accurately before starting therapy. The cause of deficiency is usually not a lack of intake, but either the results of vitamin B12 malabsorption or lack of intrinsic factor. Decreased absorption of vitamin B12 occurs often in elderly people as the result of atrophic gastritis. This is a condition that affects up to 30% of older adults. It decreases secretion of hydrochloric acid in the stomach and promotes bacterial overgrowth. As a result, these people are not able to release the B12 that is present in food, and the amount of available B12 is further reduced due to consumption by the bacteria. Without intrinsic factor, absorption of vitamin B12 is not possible. Intrinsic factor is produced in the stomach by specific cells, and these cells can be destroyed by the immune system in people suffering from an autoimmune disease. This often happens in people that have atrophic gastritis. The severe and persistent deficiency that develops cannot be prevented by normal dietary intakes of vitamin B12. Severe B12 deficiency is usually treated by B12 injections, since this method bypasses potential barriers to absorption.